So what led me to pursue my career is actually in two parts. One was becoming a psychiatrist, and then later becoming an addiction psychiatrist. Wanting to be a psychiatrist was something since I was 7 years old, and I first saw a movie about the life of Freud and became very fascinated with psychoanalysis. My father gave me a volume of Freud when I was 13 years old, and it's something I always wanted to do. However, I didn't know what subspecialty I was going to go into until I was completing my residency, when I had the idea that there was so much stigma against addicts that I thought I would do an experiment and see what it was like working with addicts, because everybody at that time was very much stigmatizing and putting them down, and I thought, well, maybe I would see if I can get along with them. And it turned out I could. So, very pleased with that choice. So what led me to addiction psychiatry is it's complex, because I'm about to write a book chapter or an article called "So Doc, How'd You Get Into This?" And as a doctor, I tend to have what's called a set of hypotheses. So why did I get into addiction? Well, I had a problem with drugs when I was 5 years old. I was using my father's nitrous oxide, and one day I forgot to mix in the oxygen, and I thought I was going to die. So I had my hitting bottom moment, but I did not go to meetings because I was 5 years old. So I have that in my history. I have things in common with people with addictions, I can get into in more detail why. But the other thing has to do with just wanting to see what it was like getting along with this stigmatized population. I went to Harvard for college, thinking I would be an English or chemistry major, which sounds strange, but actually here I am, a psychiatrist, English and chemistry. And what happened after college, I went to Columbia Medical School. So when I was a fellow studying addiction, I was also in psychoanalytic training. At the time, both groups of people were violently opposed to me. Each group was it's very polarized, because the psychoanalysts are saying, what are you doing to these drug addicts? And the addiction people are, what are you doing with this psychoanalyst? It's more common now than it was then. I also continued my psychotherapy training years later, studying internal family systems therapy, which is a very powerful way of working with addiction as well as other problems. So I'm continuing to learn all the time. Probably the most bizarre experience in my practice was I was working with somebody who had put on Suboxone for their heroin addiction, and they were continuing to use one bag twice a week. And I'm thinking to myself, one bag twice a week? Like, he's 98% better, why is he doing it? And he brought up the idea of hypnotizing him. And I thought, wow, I would never think of using hypnosis for heroin addiction, but he's already almost all better. So I decided I would have an image of taking him from a dark, dank basement up into the light of a kitchen. And as I started empathizing with his heroin addiction, I had the most claustrophobic feeling in my life and started having a panic attack once I felt what his heroin addiction was like. And I thought, I'm not going to be able to do this. I'm not going to be able to do this. And it took all my strength to pull him up into the kitchen in the light, and then he stopped the 2 bags. The strangest experience in my career. One thing that I'm proud of in doing this work has to do with my non-judgmental temperament. So I always find that it works very well. It's just very natural to me not to be judgmental. And it ends up typically gaining the trust of people with addictions. As far as my accomplishments outside of medicine, I'm an accomplished swing dancer and tap dancer. Personal inspirations include Richard Schwartz, the founder of the Internal Family Systems model, my children, Barack Obama. There's a lot more to be added to that list, people who were inspiring. Right now, when I'm teaching, I'm trying to inspire my students to become interested in internal family systems therapy, because I think it's one of the most powerful ways of working with addiction as well as trauma and many of the things that go into addiction. I also am trying to help families realize that medication-assisted treatment for opioid addiction is absolutely necessary, and that the foolish idea of detox is fatal. My aspirations are to write a couple of articles. I'm constantly bombarded with people insisting I write a book, which I don't know if I'll ever do, but I do have a couple of articles in mind, including this, as I said, So Doc, how'd you get into this? Good AA, bad AA, various ways of looking at things. Other goals are just to keep up my education in the science of addiction, as well as further training in internal family systems therapy. I've had a significant amount already. My family is always encouraging me to write more, to hydrate more, to take better care of myself, to get enough sleep, and otherwise make more of myself. I'm hoping what people can learn from me is an attitude of openness to hearing what people have to say, and to not negating their own experience, and to help guide them into preferred roles in their systems where they're not as self-destructive, and to help students also learn about these ways of working with patients that are particularly valuable and non-pathologizing. So it's a matter of working with patients, students, and families in terms of teaching them about the science of addiction as well as the psychology of addiction.